Good evening, everyone. Welcome. My name is Donna Bishop. I am a parent of two. I am a podcast host, and I am thrilled to be here with you tonight to moderate this panel from overwhelmed to understood. We have people joining us tonight from across the country, and on behalf of everyone at CAMH, we are thrilled that you are here. There's some tools that might be useful for you to use while we do the event tonight. There is the chat function on your screen. That is a public forum for you to interact with participants as you see fit this evening. Some of you might have come with a burning question. The Ask a Question box is confidential. You can put just an X in the nameplate if you'd like. That is where you can ask any of your questions throughout the evening. There's no need to wait until we open it up for questions. You can pop things in there right away. We want to know what's on your mind whenever you see fit, so use that box as you need. Our amazing doctors this evening are unable to offer personal diagnoses or medical advice, but they are going to do their very best to address the issues and challenges and offer guidance to help you feel empowered this evening. As we come together tonight from so many places this evening, we want to take a moment to acknowledge the land on which CAMH operates. Even though we're not physically there gathered this evening, it remains our responsibility to honor its history and significance. We acknowledge that CAMH is situated on the lands that have been occupied by the First Nations for millennia, lands that are rich in civilizations with deep knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds for the Mississaugas of the New Credit, as they were known at that time. Today, Toronto is covered by the Toronto Purchase Treaty number 13 of 1805 with the Mississaugas of the Credit. And this vibrant city is now home to a vast diversity of First Nations, Inuit, and Métis peoples who enrich our community immeasurably. CAMH is deeply committed to reconciliation. We honor this land through programs and spaces that reflect and respect its heritage. We embrace the healing traditions of the ancestors, weaving them thoughtfully into our caring practices. And we commit to building meaningful relationships and partnerships with First Nations, Inuit, and Métis peoples, sharing this land and protecting it for generations to come. We're here tonight because we care about our kids. And I know for me, as a parent with a teenager still at home, that when I see my kids struggle, it's just brutal. And anxiety is something that pops up in my house frequently. So I am super excited to be here to learn along with you. And I think this is as much about supporting our kids as it is supporting ourselves and each other, because there's nothing like watching my kids suffer. That makes my anxiety rev as well. So I'm super excited to hear what these two amazing doctors have to say tonight. For those of you who are not familiar, CAMH is Canada's largest teaching hospital for mental health. It's ranked Canada's top mental health hospital, and most importantly, it is a place of help and hope whenever it is needed. And that need is not just within its physical walls of innovation and seamless care pathways for all manner of mental health issues and challenges, but also by creating communities of support and by bringing support to the communities, just like this event tonight. So let's get to it. It is my immense pleasure to introduce you to our two doctors this evening. Dr. Amit Rotem is an MD, child and adolescent psychiatrist, and Associate Chief, Child, Youth, and Family Services. And Dr. Ben Goldstein, Scientific Director of the Center for Youth Bipolar Disorder at CAMH. A very, very warm welcome to you both. All right, let's dig right in and get right to it. Dr. Rotem, we are in the early days of back to school. It is a potent and hairy time for families, and anxiety can certainly be a concern for many of us. But let's kind of bring it back. When we're talking about anxiety, what exactly are we talking about? Help us understand what that is.
Hi everyone, and thank you, Donna, and hi Ben. Yes, that's a very good question, and I think trying to identify between common fear or worry and actual anxiety is very important before we get into this topic of anxiety. So I would also suggest that we, as an adult, we also check with ourselves because all of us has experienced worry or fear, and many of us also experience anxiety. So worry is commonly controllable emotion when you can typically direct to your thoughts and solve the specific problem. It's more temporary, is specific. It's a short-lived concern about defined issue like work deadline, child exams, and often resolves when situation does or not there anymore. It's also problem focused, so it prompts you to use the problem solving skills and can be rational. And very important, the impact of a war. It should not be significantly affecting your ability to function daily. So you can move on, as sometimes kids saying, I was very worried about what my mom put in my sandwich to eat, but then as fun as I found, and I could move on with it. However, anxiety is usually more uncontrollable. You struggle to manage anxious thoughts and feelings, sometimes more sticky, more ruminative. They are persistent and vague, so time frame is very important. It's prolonged state of unease, does not go away. There's reason to make the reasons to may be unclear, sometimes irrational even, and it may be accompanied by physical or emotional distress. We often say that anxiety can trigger the body's fight or flight response, leading to symptoms like increased heart rate, rapid breathing, also in the gastrointestinal physiology, for example, nausea, stomach problems, headaches, fatigue, feeling being on the edge, these kind of symptoms of anxiety. And interestingly, younger kids may sometimes present these physical symptoms before they can identify even what's going on in the emotions.
Well, and that's a good point because I imagine, things will present in a 6-year-old differently than they will be in a 16-year-old. So perhaps is there kind of a continuum that you could explain to us with some basic like developmental milestones to help us understand how to kind of see things as our kids grow?
Mm-hmm. So we can discuss a bit, just on what's going on with normal development versus where we can, be a bit more concerned or what should be a flag for us when things are not going as they should have. But I think it's also important to say that child and youth develop at their own pace, moving through distinct physical, cognitive, social, and emotional stages. And emotion reactions are a normal part of the process, right? But the pattern of where it comes to intense and prolonged emotion and distress, that's maybe singularly need for more attention. And we can, if you'd like, and we can go, for example, when you talk about kids between the age of 4 to 12.
Hmm.
So normal emotional reactions can be, they acquire the cognitive skill and language, so they can use word to express feelings and show more developed empathy. They can begin
Hmm.
understand the multiple feelings, and lots of things occur at once. So some dramas can occur. It's normal when they navigate complex relationship and social rules.
Yeah, we're not going to
However,
be calm the whole time, right? Like there's going to be some
exactly,
outbursts, in the
exactly.
best of times.
Exactly. But however, when we see more frequent intense mood swings, when we see excessive outside spheres of worries that disrupt the school they play or social activity, where they have more physical symptoms like headache, stomach ache, when there's persisting so much that they drop for school or they avoid school or they withdraw from friends. And there's also persistent defiance of the liberty, being disobedience towards authority figures like us
Hmm. Hmm.
parents or other figures. That's becoming more awards at these ages. And with regards to adolescence, if we think about normal responses, so Adolescence is where puberty and development of reasoning skills contributes to heightened emotions and mood swings, right? It
Hmm.
is normal for teens to push for independence from parents and for peer relationships to become increasingly important. You know, I like this thinking about adolescence period, like we parents put our adolescents on a big boat while going on a very, very stormy sea with other peers. We are not allowed to go on this boat. We are just hoping that they are equipped with everything that they need in order to navigate in the stormy sea. And we are going all far away to wait them in the other side, which call adulthood. So it's very stormy, but we as parents hope that we gave them all they need in order to sort of survive these adolescents. Still, one can be have more concerns about adolescence, where there's a persistent sadness or hopelessness that lasts more than weeks in a row, or any expressions of worthlessness when they present self-harming or any suicidal thoughts. I think that's important to take very seriously any talk about self-harming or
Hmm.
death or
Hmm.
hopelessness, and needs to needs immediate attention. Increased risk taking, like a pattern of dangerous self-destructive behavior, such substance use or reckless acts. And I would also mention social withdrawal or withdrawing from friends, family, or activities that is sudden or extreme. These are all flags that
Hmm.
we as parents or caregiver may perhaps want further attention.
Okay, so I just want to reflect something back to you because that was like that's a lot for us all to take in. So if I tell me if this is right. So whether it's a because we I appreciate that childhood is fluid, so we don't want to make it sound like our goalposts are, rigid for ages and stages. But if my child, whether they are, 10 or 16, say they're complaining about not wanting to go to school, that's perfectly natural. Not all of us love to go to school all of the time. I'm worried, I don't want to go, I don't want to go. The child that eventually has their breakfast and gets up and goes to school would be, not cause for worry. But the child who flat out refuses, maybe they refuse to get out of bed, they do something extreme such that they are not actually doing that thing which they're refusing to do, that's when parents might want to say, okay, maybe this is something more than just a natural developmental, I don't feel like doing this right now.
E-
Is that
e-
fair?
Exactly, because school refusal can be actually a result or just one of the symptoms that he the child chooses to show us that he's actually in struggle, that we should take it from there as an adults to understand what's going on.
Well, and Dr. Goldstein, maybe you can jump in here too, because I know I remember for myself, it was, the mornings and the before bed when often, those tension moments came. What do we need to do in those moments, or what can you suggest to parents and caregivers when we're in those moments of tension that aren't a red flag? What are the things we need to remember and execute to support our kids, because there is a certain amount of, sometimes you just have to go to school, right?
Yeah. Donna, remind me if I forget to come back to this, but I wanted to emphasize a point that Amit said, which is that I think we have to start from the position that anxiety or fear or worry is an adaptive function and a survival instinct. So on one hand, it's something that links us all as human beings. On the other hand, it's also the single most common psychiatric diagnosis in children and adolescents. So both are true, very common, but it also commonly goes, overextended. And then to your question about those junctures, I really think it depends on the age. Like, if you're 3 years old and you go to a birthday party and you're clinging to your mom's knee and don't want to talk to the other kids, that's, developmentally normal as long as you're going to the party and eventually make some friends. If you're 13 and doing that, that's very abnormal, right? So
Mhm.
there's, I think, Dr. Rotem's points are well taken that there are pretty like strong differences between kids and teens, and like you said, Donna, they evolve over time. In terms of, your question about intervention or prevention or what parents can do, I think I wouldn't want to oversimplify it. What I would say is it really depends on the kid and the circumstance. But no matter the type of anxiety disorder, so there's separation anxiety disorder in young children, social anxiety, where people fear how they speak in front of others, how they appear to others. There's general anxiety, which is a kind of a diffuse difficulty controlling worries that I think Dr. Rotem gave a great example of with all the physical symptoms, panic attacks, that sort of thing. So it really does depend. But no matter what the type of anxiety disorder, the reality is, and this echoes your comment about sometimes you just have to do it, is that exposure to the feared thing is going to be a key part of getting better. Whether that getting better means, within your mild symptoms or within a severe anxiety disorder, there's no getting around it. So avoidance would be the opposite of exposure. And that is just, I frame it as you said earlier, I focus on youth bipolar disorder, but 80% of my patients have anxiety disorders. And it is typically the theme that I'm dealing with clinically, even though bipolar is the diagnosis that leads them to me. The issue that causes them challenges in their life is anxiety. And there's just no way around the idea of exposure and avoidance, which is you see something scary and you back off of it. If it's a tiger, that you want to definitely do that. If it's your school teacher in, sixth grade, it doesn't help you a lot to avoid it completely. So um, I think that a theme when you talk about parents is the balance of accommodating, trying to understand your child versus not enabling them to avoid the learning opportunities that come from being uncomfortable. So it is not abnormal to feel uncomfortable. And I think that that's an important point that I would make. We can probably get into more conversation about this, but I think the line of when to back off and when to stay on, it's tough. But I'll just say this, when kids are really young, society legally expects parents to watch for their physical safety. They expect them to be omnipresent. They expect them to make sure no risk befalls a 6-year-old. At 18, at 17, I think, and we had this conversation earlier, Donna, that a lot of parents see that as still their ongoing responsibility, but it's not their legal responsibility. The same is true for getting a kid to a dentist, to making sure they eat. So there is a change. And I think adolescence comes with the themes that Dr. Rotem mentioned, which is the understanding that this is a ship in a storm and you have to kind of do what you can to equip the ship and be there to support. But if you're in the boat all the time, you're not helping the kid launch into adulthood.
You were talking about those different types of anxiety, and
Mm.
I'm just curious, people might be wondering, are they like building blocks? Like if my child has social anxiety, then they're going to be predisposed to other forms of anxiety, or and appreciating that every situation is unique, but how do they work together, or are they isolated in and of themselves?
These are great questions. So I think it depends on what kind of a population. So in my population that I treat, the average person that I see has 2 to 3 anxiety disorders, but that's not going to be true in a school setting. What I would say is that generally speaking, people that get to the clinical point of having one anxiety disorder often go on to have another, and it's similar attributes that predispose people to each. So the separation comes because the first challenging thing is separating from mom or dad. And then social comes from, oh my God, I have to like give a speech or go on a date, right? And so those things don't happen when you're 3. So, I think there's developmental changes, but it is true that there tends to be like an age of onset sequence and, separation anxiety, something that we call selective mutism, kids that don't even want to talk in front of other kids, then social phobia, and then things like panic disorder or generalized anxiety. They tend most commonly to emerge in later childhood or early adolescence.
Can Dr. Rotem and Dr. Goldstein, can you talk for a minute about just sort of the reassurance of, because I'm seeing, I can imagine parents going, oh my goodness, my child has all the anxieties. They're not wanting to go to school. They hate eating dinner. Ah. So how do we as parents kind of, is it just like our instinct, our self-knowing of being able to say, okay, like there is value in the exposure, in the pushing through the discomfort. How do we know when to push our kids? Because I hear you saying that there is important growth in moving through the discomfort and the exposure of going to the birthday party or eating the tomato when you don't want to have vegetables or talking to saying thank you to the person at the store who gave you, your lunch. Like, how do
So,
we?
Don, I'll jump in. I'll share a
Yeah.
metaphor. So, I think that it's a steep hill to climb. This issue of anxiety. It's only going to get steeper with avoidance. And so, I think it's just a reality. So, there's discomfort from the idea of not innate. Some kids they're not disruptive. They don't necessarily have a mood disorder, but they will get intensely emotional if you pressure them to do something. And it's very natural to back off of such a situation. Nobody wants to torture their kid. at the same time, consistent backing off, systematically backing off, is just making that hill steeper and steeper to climb. So, not going to school on one day is one thing, for a week is another. All of a sudden, you have like school refusal. Now you're in a separate school. This hill gets steeper and steeper. So, I think, I say that not to be dire, but to say that to embolden people about the idea that some discomfort is not necessarily bad and that some tension early will help prevent, or in many cases can help prevent, larger tension later.
So, parents, let's sit in the security of knowing that when we push our kids a little bit beyond their comfort zone, we're actually helping them develop in a very positive, important way.
I mean, I think that's true for key aspects of developing. So thinking about what do you need to do to become an adult? You need to, most people need to leave the home. Most people, things that we dream for in children when they're born is that they have an independent life, can take care of themselves, perhaps meet someone, all those sorts of things, but definitely get along with other people. So I would say that what you're saying is true, provided that it focuses on key functions. If it's something like become the best violinist in the school, or be the captain of the basketball team, I think then you're stepping kind of broader than core requirements. And then I think it's a different story.
Dr. Rotem, you were talking about the, different stages in terms of, development from childhood to adolescence. And
Mm-hmm.
I'm wondering if, Dr. Goldstein was talking a lot about, those were like strategies for younger kids. Like sometimes you just have to,
Mm-hmm.
support them through the discomfort. What would you say to kids or to parents, pardon me, that have teenagers and older kids where
Mm-hmm.
that tension can be a little harder to maneuver?
Absolutely. So yeah, I think it's in continuation, in addition to what Dr. Kirsten said. So, and when I sit with kids or clients and ask them what would make your anxiety less, or when you're talking to me so beautifully, and I don't see any social anxiety here in the room, and you don't want to you don't have panic attack here as you just had outside in for example on going on the subway or whatsoever. What would be helpful, or I have heard so many times, only if I could communicate better, only if someone that I trust heard what's going on with me, so I could trust. And this I already extrapolate, but it takes a lot of to get it from the teenagers. But what I'm hearing is trust, open communication, hear me, hear what I need. Please don't jump to conclusions. Certainly, if I'm as a parent a bit anxious, don't assume that's what I'm having, that's what you are having. Perhaps it's different anxiety, as Dr. Goldstein does suggested, lots of with the same spectrum of anxiety, but different. So please ask me, please check what I need before you're doing something. Let's try to do it together. Let's try to remote it. So there's me as a parent, there is a kid, and the anxiety is a triangle. It's not between of us, it's there. And let's do it, make it a win-win situation against the anxiety. This kind of stuff that I'm hearing. And I think when we then bring back the family, whoever family members, and have this conversation together, it starts to make sense that actually there is the problem, that it's there and it's make mess to everyone. But let's see how we make this together. So open communication is very, very important. But of course, encourage healthy coping, as Dr. Goldstein mentioned, and see how you can walk through avoidance and seek more professional help. That's very, very important. And yeah, and try to do it together as much as you can. It doesn't go without saying we are all busy these days, right? But the fantasy of a kid or a baby as he born, that as we mentioned before, there's a separation anxiety, even subconsciously. I mean, that the parents would never leave them. So also adolescents have this wish that they would never be left alone, right?
Well, and
So
I think as parents, we have a very understandable desire to want to collapse the distance of discomfort and suffering for our kids, especially because we know we've gone through it. We know the pain of, you know, how much it takes to make friends. So if we can collapse that for our kids, then we think we're doing them a favor by lessening their discomfort. But what I hear you saying is, you know, that probing, that asking questions, which can feel like elongating the process, I think sometimes is actually what is required in order to help our young people develop and grow and manage that day and going forward.
Absolutely. And also, I'm sure the Dr. Goldstein would like to add more, we also don't speak the same language. So I can speak about myself when I was an adolescent. I spoke with my parents like directly. There was no social media. We didn't speak with the hands, with the fingers. Our kids these days speak their own language, and sometimes parents, when they want to communicate, they don't even understand the jargon, right? Or and suddenly, if they communicate bad thoughts, if they communicate anxiety, worries, it sounds different. So it takes for us, the other generations, as they call it, a time to explore, to ask. I wouldn't expect us to go there to what they are using and even try to understand. I also don't think that we can shut it down. We'll have to join it. We'll have to help them bring it to us and see how we can help. That's where I think the world going into these days. If it
Dr.
will,
Goldstein, can you, I see you smiling, can you jump
Yeah,
in a little bit
yeah,
there,
I
the
think
importance of meeting kids where they are?
Yeah, I mean, I was going to say that I think the like what you do as a parent depends on the severity level of the anxiety. So, you know, if a child or an adolescent has quite mild symptoms, then supporting them and encouraging them, the parent has you know, central role. But if they have moderate to severe anxiety at a clinical level, you don't want to pretend like that is going to be sufficient necessarily. And I think part of the parent role there is to name the anxiety as an issue, go for an assessment, look for treatment options, and then once you have those treatment options, support your child in making the best of those. You know, I mean, I think one of the things that I believe to be true, seeing, you know, having seen a lot of kids go from, you know, 13 years old to 20 years old, is that all the discomfort that comes from anxiety evokes in people a reaction that eventually is going to serve them very well in adulthood. And what's really uncomfortable when you're 14 is part of you becoming the adult that you're going to be. And I know it's, you know, I think for a parent, it's really hard to watch because you just don't want that distress, but it's really part of this person becoming, you know, a full personality and a full adult. So, but the main thing I think is just separating mild anxiety from anxiety that needs something more than parental support. And
And
what you
we'll
don't
get
want to
to
do is you don't want to wait too long.
Well, and we'll get to the resources, and I just want to
Mm.
reassure people that, you know, there will be a toolkit coming in your inbox, and certainly if our conversation is eliciting questions, you know, that ask a question box is there for you to put something in. We're going to open the floor up to questions in just a little while. But Dr. Goldstein and Dr. Rotem, I'm wondering, you both have such robust practices that I'm wondering if you can think of maybe, you know, a really successful example from your personal experience where you've really seen a family use strategies in a really successful way, so that we can kind of, you know, get a picture of a real life example of how parent and child have worked together to to support the young person as they manage something.
I could take a first shot at this one because in anticipation of this event, I have some patients who are now in their early 20s who had, you know, suffered from severe anxiety, but are now doing really well. And so I had the opportunity to ask one of them, what would you say at this webinar? So I won't name this person, but I send
Good instinct, Dr. Goldstein.
guidance
Real life.
from the lived experience. And so this is and it doesn't necessarily focus just on the parents, but from a teenager perspective. So this was related to school anxiety in particular and academic anxiety. And the suggestions were, first of all, you know, prepare the best you can and take care of your lifestyle the best you can in terms of maintaining sleep and nutrition and exercise and not letting everything go just in the, solitary purpose of grades. The second is to recognize that there may be, no matter what you do, a disconnect between your goals and where you're at. And that if you're truly at the point where you've done everything you can, to accept that difference and not fight against it. So this is something that this person said, had they had, if they could go back in time, they would have gained acceptance about that earlier. And that could relate to accepting accommodations, could relate to
Hmm.
dropping a course. It could be anything like that. So those are the thoughts from a lived experience. And then that person's parents, I think, what they did was really reinforce the importance of accessing treatment in that situation,
Hmm.
and supporting the strategies that were, adolescent driven, but that needed some environmental, accommodations to make sure they happen.
Dr. Rotem, I'm going to jump to you in a sec, but Dr. Goldstein, I'd just like to follow up on that a little bit because you mentioned, school and the classroom and accommodations. And I'm wondering, like, we have people from all over the country, so obviously resources are going to be different for a lot of people. But what do parents need to know when it comes to working with their child's school and classroom teachers? How would you suggest parents go about starting those conversations if they want to use the classroom as a supportive place? Or maybe even the issue is that their child is managing is coming from something within the classroom.
Yeah, so I think I'll share principles that I think are, universal or general. One is, these are your partners, and you can put something in the letter of the law that doesn't necessarily get enacted, and so the relationships remain very important. And there's going to be a sense of urgency to get things the way you want them. But I would just encourage to remember that on the receiving end, in terms of the school, teachers, guidance office, and everything, those are also humans, and so it is a relationship that needs to be treated as precious. At the same time, I think it's important to get accommodations that are needed. Any mental health practitioner wants the youth that they're treating to have their academic performance reflect their abilities and their preparation, not, freezing in an exam or that sort of thing. And so I think for those who need accommodations, it's important to make use of them.
I know
And
my
that,
daughter has accommodations and
yeah.
they're absolutely invaluable. Some of hers include, increased time for exams and whatnot. Can you talk a little bit about the accommodations that parents might anticipate? So for people who have no idea what that means to have accommodations within the classroom, what are some of the kind of like big picture things that they can anticipate possibly being an option?
Yeah, I mean, so if it's in my practice, the first thing I do is ask that parents are speaking with the school as a first point of contact and figuring out what the reflections are from the school and seeing what the school can offer without a letter of accommodation, because there are a lot more things than there were 10 years ago, even, that are just universal and don't require this level of involvement. If it does require, a letter from a physician, for example, then you want to make sure that there is, kind of circling back to the accommodation examples like one you gave just now, which is extended time to write a test. For some people, it could be writing the test in a quiet place. For some people, it could be some flexibility, and this may or may not relate to anxiety specifically, but some flexibility around deadlines where there's a little bit of an error bar around the deadline for a project, that sort of thing. And I think with increased acceptance of these symptoms being really common, I think there's increased pressure on school. And so I don't think this is necessarily an automatic sort of thing, but that's the type of accommodation that I've seen helps young people, show their best stuff.
Dr. Rotem, what about in your practice? Do you have an example you can share of when you've seen um, success in helping young people manage their anxiety, perhaps going from one place to another, or maybe there was a specific issue around maybe, I know you do a lot of work with nicotine or tech. How have you seen parents and their young people work together successfully?
Oh, absolutely. Well, I mean, we can talk about addictions perhaps in, I'm not sure it's the scope of our talk today, but I can certainly say that I recently met with one of our former clients here, just because he's former, because he's doing great. And he decided that he started engaging with our service, having a severe social anxiety, school avoidance since the age of I mean, talking about primary school, and later on at the age of 15, 16, really have also developed panic attacks, and then um, with it was very challenging for him also to seek support until unfortunately he actually communicated his sorrow by actually becoming very, very depressing, and also had some suicidal thoughts. So only then he communicated to his teacher, that brought him to emergency room. Then we saw her in the youth urgent care that we have in CAMH. We could communicate with him what's going on, do an assessment, and when he became more open to conversation, we identified there's a severe social anxiety, generalized anxiety with panic attacks. He was engaged in cognitive behavioral therapy, also in the mood and anxiety clinic, and his parents were also engaged in some group counseling that we had for parents here. Um, to make long story short, now he's almost 25. He passed by to tell me that he's one of leading actors in a Canadian association. So he's actually acting in shows in stages. So it's all contradictory to social anxiety, and this is a kid that got need to be exempt from performance, or actually from presentations in school. So I think for me, and he gave us a great example of, with intervention and support, things can be changed. And we have also, and I'm sure Dr. Goldstein speak as a researcher more about this, we have also biological reasoning to believe that the brain can actually change. It's not forever, and that's it. We can also actually impress the brain or have affected brain to change, and to work differently. He told me the only thing is, I wish I applied earlier in my life for everything. I wished I knew that even as a kid, I can do cognitive behavioral therapy, as my parents can do it together. That's all. But he was very thankful, and so that's, and I have many other examples. So these are treatable conditions, I have to say.
Well, and that's so hopeful to know that, because anxiety can feel so paralyzing for the young person that is experiencing it, and also for the parent who can feel paralyzed, not knowing what to do. So that notion and that evidence that our brain can change, and that this young person can go on to be 25 and have this like fantastic thriving life, is amazing. For the parents that are listening tonight and they're like, yeah, but my 6-year-old's morning routines are making me crazy, they won't go to school, they don't want to put their coat on, how do we bring that hope and distill it into like early childhood for those young families who are like, I'm just trying to get my kid to school and they're losing their basket? Do I need to get them assessed? What can I be doing right now when we get off this call to kind of help me through this?
Want me to start?
Yeah, you go ahead, Dr. Rotem.
Again, we can discuss about
Yep.
it.
We'll get you both
Well,
to jump in.
I,
Don't you
I
worry.
yeah, I suggest, again, it can be very, very overwhelming, this situation, right? And we really care about our kids as parents, and it can be very also for us. It's a two-edged sword, right? I mean, we need to act, we need to do something, but then it's very concerning. We will be too much, we will be overdoing, and we don't want to cause further harm, right? So I wouldn't suggest that the parents will be those who would make the assessment, or the therapist, right? I would start by communicating with the educational team, for example. If it's kindergarten, if it's school, go to the teacher with open communication, raise your concern. School counselor, this is what I'm seeing, that's what I'm seeing at home. Do you see it also in classroom? What's going on? And again, I appreciate that everyone has to will be busy, but we I would prioritize this and make time for this. And kids appreciate it, that we are concerning, we have concerns there, and we take it into priority. And from then on, perhaps the educational team will make some recommendations or provide more directions. Then there's also the family doctors, there's the or other in the community that we can consult with and provide us some more information, and may refer to for further support, including assessments. But I think that it's important to have um, a clear directions how to navigate in this situation, and also to get support for us as a parents, not to not to try. And again, as Ben said, for mild cases, we probably with our good intuition, we are already doing it, and things will solve. But as you asked Donna about those cases that are very, very overwhelming, and we already tried and it's not working, then I would say, as I suggested above, that's what I would do.
And it
Ben,
sounds,
yeah.
what I hear you saying is, as a parent with that, the morning routines are getting, tense. Try different things, like, help that be part of your gauge of just, how manageable is this for your child, and really like be present and pay attention to how your child is reacting in the moment.
Exactly. And I would also just mention that, positive rewards, and besides the exposure, positive rewards is very, very important. So at one point, I would ask also the kids, what would you like to get if you are doing so and so? And then it should be very immediate. I'm not talking about something that's expensive, or it shouldn't be something that, usually these are things that we can be affordable. But what's important, that it will be right on the spot. So for example, and also achievable. So
Mm-hmm,
telling to
mm-hmm,
the kid, if you will wear your shirt, or if you will wake up as we plan for the following month, 30 days in a row, that's not achievable
mm-hmm,
for us.
mm-hmm,
Only
mm-hmm.
then I'll reward you. That's not, that won't work. It should be day by day. It can be very overwhelming, and sometimes get burned out. But these are in the milder cases, it's actually work. But then in the more higher anxiety, higher stubborn situation, there are ways to get help and support in this. I'm sure that Dr. Goldstein may have some more ideas.
Yeah, Donna, for this particular question, you framed it through the lens of a parent who's overwhelmed, and I just wanted to bring a different lens. And I mentioned this, with recognition that in our field, it's been characterized in past decades by a lot of parent blaming and a lot of mother blaming in
Mm-hmm.
particular. So whether that's autism or schizophrenia or anxiety. Having said that, parents are people too, and and psychiatric disorders, including anxiety and depression, affect people too. So I think that it's important not to lose sight of the possibility that someone may themselves be struggling with anxiety or depression, and that it doesn't mean that what they're facing isn't real. It just means that the extent to which it impacts them may be influenced. The extent to which they're worried about what it means may be influenced by their own, state of mind. And not to talk statistics or anything, but there was a large influential clinical trial. This was for depression in mothers, and the focus was on just treating depressed mothers, but they also studied their kids. And what they found was moms who were effectively treated for depression, their kids' own symptoms, even though the kids weren't getting any treatment in this study, their kids' symptoms improved, and the chance of a kid who didn't have symptoms developing symptoms reduced. So I'm not saying this is the
Mm-hmm.
whole story, but you have to consider the whole family unit and the fact that just the health of all family members, it could be a sibling, it all comes into play together. And I think it's important not to miss it, because you can have people that are very successful and have got adults and have gotten through life just kind of pushing through and never got this named. And then, you realize that maybe there's something that hasn't ever been treated for them. So I need
Well, we're
something to
all
reflect
such
on.
complex beings with layers of what we've addressed and what we haven't. And that was certainly my experience with postpartum depression is it was brought to my attention that it was not just for me, but it was for the health of my baby to get treatment. So I think that's such an important thing to talk about. Is it's we're talking about youth mental health, but really mental health is a family journey at various it ebbs and flows at various times.
Yeah.
And what do every family is different. We have people on the call tonight with different diversity backgrounds, racial backgrounds, neurodiversity backgrounds. Without getting to obviously like clinical or specific, but what should we be aware of when looking at ourselves, or what questions can we be asking about our family as a whole that might help inform um, how to support our entire family from a mental health perspective? Do you
Hmm.
want to take a stab at that, Dr. Goldstein? I know that's kind of a
Sure.
big question. I just
Yeah.
dropped like the can we talk about this for 5 hours? But
Yeah.
simplistically speaking, what would be good things for us to consider ourselves in from a mental health perspective?
I mean, as a blanket answer to your question, I think you want to take a personalized approach. So if someone comes, if someone's a first generation immigrant, if they've been exposed to significant trauma, now that could be, you know, they're refugees here and they've had trauma, or that could mean that they were born in Toronto and had trauma. Either way, trauma is going to predispose people to anxiety, and it's going to inform modified approaches to treatment. So generally speaking, people that have had trauma who have anxiety require longer courses of treatment than people who have anxiety without trauma. And you don't want to be, you don't want to be agnostic to that. So like a 6 session skills oriented, here you go, good luck with that is not going to work as well for someone with trauma as it would without. So I think that would be one example. I mean, in terms of ethno-racial or those types of things, I think there's differences of opinion on this matter. I'm of the opinion that I hope that any well-meaning, a non-judgmental, humanistic practitioner can treat anybody that walks through their doorway. That said, you want to accommodate cultural traditions, manners of communication, uh, within reason, right? Like, so for example, it might be a cultural tradition that a parent stays in the room for a medical examination of a 19-year-old woman. That, then that's a little bit different. But there's a lot of things that can be integrated safely and ethically.
Dr. Rotem, did you want to add anything to that? What, families can kind of be thinking about as they embark on this mental health journey? Or maybe you'd like to jump into some resources, because we've talked a lot about, accessing the classroom, talking to perhaps family physicians. Are there any other resources that you would like to
Mhm.
highlight, understanding that there will be a toolkit that's being sent out to all of us who are attending this evening after the event as well?
Yeah, I would just add to what Dr. Goldstein said that I always see mental health and specifically anxiety in the context of the culture. By asking the clients, by asking the family, I learned so much that anxiety has been rooted in cultures in different ways, and also people have, and I always honor the ways that people try to address it, and try also to add sometimes traditional ways to untangle anxiety with the more treatment that we offer. And that's what I think the beautiful parts of how we are coming together to solutions. So and in Canada, it's amazing how we shows that multicultural aspects of mental health come to different solutions to this problem. But the anxiety is amazing how it's regardless where are you in the globe, the same fight or flight, the same symptoms will be there. We are all human beings after all. And that's been reported elsewhere. And so to your question about resources,
Mm-hmm.
so we yeah, so I think that
Or
as
maybe
I,
Dr. Rotem, you can
mhm,
even maybe be a little more specific. If a parent is, this is
mhm,
their first time, sort of wanting to talk to the classroom teacher or maybe talking to their family doctor, how would you suggest they go about doing that? How would you suggest that a parent or a caregiver start to open up that conversation with a trusted, physician or teacher, because that can be kind of intimidating as well, because there still can be some awkwardness around revealing some of these things.
Oh, absolutely. So first of all, I would like to remind everyone that these care provider or educational team should have get the training. So they've been there, they've seen there, they should have the ability to contain this kind of approaches and questions, right? So they shouldn't be surprised by any parents coming to tell me, listen, I have a behavioral / anxiety problem with my kid, right? First of all. Secondly, I think it's very important to discuss it with the kid before you do anything. So to an extent, I mean,
Can you
that's,
talk a little bit more about that? Like, what would
yeah.
that look like with, say, a 6-year-old or a 12-year-old or a 17-year-old? Because that's going to be very different depending on what stage your young person is at.
Absolutely. I mean, that's again speaking back about the open communication. I think it's so important to sustain and maintain because if we, on the other hand, if we go behind the back, so to speak, and go directly, that would break trust. That would break communication. That will can cause even more anxiety.
Mm-hmm,
but
mm-hmm.
but being transparent, being showing that you are worried, and showing to your kid that you are worried about him, it can even strengthen the communication. It doesn't show that as a parent that you are weak or you don't know what to do, that you are telling him that I understand it, and when you name it you can tame it, right? So I see that something is not good and we are going to seek support. We together are going to seek support, and I think starting with school is making lots of it resonates with most parents and kids, but also depends on really of the communication. Sometimes it's the family doctor they feel very connected with. Also, if the symptoms or the signs are already flagging or already severe, I would argue that going to speak with the pediatrician or the family doctor it will be good timing. Again, with the kids, they will probably also would like to discuss or assess the kid, and perhaps they will suggest referral. But school team, again, this can be the teacher, the counselor, there's nurses, as many schools also that are equipped to also to support with mental health or other problems that related. Um, yeah, and then we also created this package for everyone that they are, in case that they are, would like to approach other services or to look who they can consult with, both for parents, both for their kids. One of them in the package, I hope that everyone can see it now or would soon be able to see.
Yeah, it will come to everyone after the event. Yeah, but what I hear you
Fantastic.
saying is it's important to, just reaching out somewhere, like not
Hmm.
to like stress too much about doing the right thing, but to seek support somewhere is better than doing nothing at all.
Absolutely, because again, getting more directions and more clarification, and most of the most of us of would need further directions, right? Because again, these are conditions, these are problems, and sometimes mental health disorders that need to be addressed. And as we say in CAMH, mental health is health. So
Mhm.
when you have chest pain, you would go to emergency room, right? So when my kid is unwell, I would seek support to check what's going on, right?
Right.
So again, that's just an example, but it's a common one. That's why I'm using it.
Absolutely. We're
Donna,
going to get, yeah, please jump
I would
in.
just echo what Dr. Rodham said about not going behind the back. I just think that like it might be a short-term fix, but a long-term problem. And then the flip side of that is also a theme that we haven't talked about yet, which is confidentiality. And in terms
Mm,
of building trust in a young person about going somewhere, they need to know that what they say is going to be private unless there's some sort of safety consideration. And I think that's sometimes tough for parents to not know, what are you talking about in therapy? What did you guys go over today? And I think just recognizing that part of the parent role is to entrust the person you're bringing your child to be doing the right thing, so that they can do their job.
That's such an important point. Thank you for raising that. And we're going to open it up to questions in just a minute. But while we're getting ready to do that, Dr. Goldstein and Dr. Rotem, I wonder if you can both, kind of offer, one key message or idea that would be good to just empower us to let caregivers and families leave tonight with something that is a message you'd like them to have as they go on about the rest of their week and months after this. What's something that you'd like them to take away with tonight?
I mean, I would say that these are very treatable conditions, anxiety disorders are, and also very preventable conditions. So that's one thing, just that for the vast majority of people, things can go well. And then the other thing is that every little bit matters. So when you're dealing with someone that has bad anxiety, like a 2% reduction in their symptoms would be something that they notice. And so recognizing that there's lots of things a parent can do that doesn't involve prescribing a medicine or, administering cognitive behavioral therapy, but it could involve doing things that support their physical activity or their sleep or, other things like that. So it doesn't all have to be medical, and every bit counts.
Thank you. Dr. Rotem, what would you like to add as a message for parents and caregivers tonight?
Yeah, I mean, in addition to what Dr. Goldstein said, which is it's a wonderful. Yeah, I mean, hear your kids. You brought them to this world, the hectic world, uh, and see, maintain open communication. That's so important, and build trust. And if they are becoming anxious, please seek the appropriate support and remind yourself that perhaps you also have the same experience when you were
Mm-hmm.
earlier yourself as a kid or adolescent, but in different ways, because you're not the same. But now they are here and they are looking for your support, and of course they will approach you and not others, because you are their parents,
Yeah.
with no blame, without guilt, no shame, just being their parents. That's what I would suggest. And yeah.
Well, and your message is a perfect lead in to our first question. What's being asked is that some of these conversations can be difficult to approach. So people are asking, what about when your child is not talking to you about any of the issues or challenges that they are facing, even though you know that something isn't right, they're not opening up. What can you do when you are feeling that kind of isolation? Like, what do you do when you don't feel like they're sharing, but you know something is not right?
I think the first step, Donna, is to know that you can't force it and just reach acceptance with that. And that
That's
everything,
really hard, Dr. Goldstein.
easy to say, hard to do. But I think, like anything else, the sooner people reach that acceptance, that doesn't mean backing off, right? So you can be actively present, but not pushing for a conversation. You can go for a walk. You can let a person know that no matter what it is that they have to tell you, you're going to help them with it and you're going to be okay with it, and give them that. Who knows what worries they're having and what they think you're going to be thinking about that worry. Um, who knows, maybe something happened, that they don't want to talk about, whatever the case may be. I think parents worry about their kids, but kids worry about their parents. And you need to let them know that mom or dad's like going to be good with whatever it is that you have to say.
Dr. Rotem, I see you nodding along there. What would you like to add to that?
Yeah, because it's so common question that we have here, right? So I would just add that communication or is not only language, is not only speaking. We can communicate with our kids also in different ways. Sit beside them, be there, write to them, play with them, go to a movie with them, right? And we all can also state to them, like we what we see, like to validate. We see that you are unwell. We are concerned about you. Should we? Sometimes
Mhm.
we suggest non-verbal gestures, right? Like
And what do you mean by that? Like, are you saying like kind of it's just enough to, you know, sit beside your kid while you watch TV? Like, because it can be all consuming to feel like you want to do something.
Right. So it is almost like asking the permission to do the right thing from the kids. It's
Mm,
not enforcing yourself, right? So ask your kids what's going on. Ask, can we do something? Now, when kids are doing other stuff with their peers, when they prefer to do stuff again that you're not concerned about, but they do, perhaps they are fine.
mhm,
Just seeking independence. That's the stage for you
mhm.
to be proud of them. But if they don't do anything, like they sleep all the day, they also don't communicate with you, although you're concerned, that might be one of the flags that we suggested, that perhaps you may want to tell them, listen, I'm worried about you because you are not at your as you were even a few months ago. I've seen you doing much better, and now I'm worried about you. Can we talk to someone, for example? This kind of communications.
So I'm
Um,
hearing an important kind of balance between the actively asking questions, but as you said, Dr. Goldstein, also being okay with they might not answer the first, the second, the 12th time, and, you know, being okay to be with them even if they're not talking all the time. We're getting some other questions around the stigma of labeling that can come with anxiety and accommodations that could make some kids feel like an other or that they're being singled out. What are some strategies or some thoughts around being comfortable with accommodations or, just even saying this is something that I am impacted by right now?
Yeah, I mean, we like you're describing essentially what's the bar for what we call caseness, where you go
Mm,
forward for this or you don't. And, as psychiatrists, we make this decision about medications all the time. And I'll start with my answer for that, which is we generally, for anxiety, focus on therapy first and medication second. And what I would say about medications for anxiety, um, you know, don't take them unless you need them, in which case you
mm,
should take them. And I think that the same type of, which means there has to be a certain level of symptoms, it has to be worth it. And so that's the question for the young person. How bad is their anxiety? What is the impact on their life? What is this keeping them from versus just distress? So, I mean, I think that's an individual judgment call to make.
mhm.
I would just say that in my own practice, uh, most people don't avoid, and I think that in universities for sure, they're dealing with everybody asking for these things. So I think
Yeah.
things have definitely shifted, but I also recognize that it's valid, the idea of stigma and being separated. And I would say is if that separation is going to do more benefit for your child than harm, that would be a tilting point someone might consider.
Hmm. Hmm. Dr. Rotem, do you want to chime in on that? What about?
I just wanted to clarify that when someone is issue or applying for accommodation, we don't have to mention specific diagnosis, just in
Mhm,
case no one, it's the first time for our participants. So it can be very generic. It will be just, we may request some help, and school does, or any other academic institute does not have to know exactly what's the terms or what's going on, right? And the
mhm,
kid
mhm,
does not have to disclose. They also don't have to use if they don't want it. It's their right. It's not, they're not obliged to have it.
mm,
But I think it's very important to be in place, ready for them. And as Dr. Goldstein said, it's very common in university nowadays to apply for this. Also very developmentally appropriate, as young adults, people want acknowledge this support. As kids, sometimes schools also cannot afford this. They know that kids, but they have lack of resources. We still encourage, we still help, we still getting the support, but we don't have to name the reason.
right. Another question we're getting is that recognizing that sometimes it is necessary to gently push the boundaries of discomfort to broaden your experience. how can a parent manage the fatigue and the distress of doing that for their child? Like, it sounds like this parent is saying, I am feeling the fatigue and the distress of pushing my child's comfort zone. What can I be doing to support myself in this moment so that I can be there to continue to support them?
It's a tough one.
It is a tough
Yeah.
one.
I would say like not make an assumption about like an individual has written that question, and so I wouldn't speak to an individual, but the things I'm thinking about are this is, is this the last drop of water that makes it overflow out of the cup? Are there other sources of stress going on that can help with managing this stress, which you really, you want to be engaged in? Is the parent themselves having other challenges or mental health challenges? And let's assume for the purpose of the way this question is framed, that really things are fine, but it's really the exhaustion of the relentlessness. And it's true that anxiety is often relentless day to day,
Yeah.
and it can be everything. It could be like what kind of gloves someone wants to wear, or which way you're going to drive to school. So, um, this is not for the meek, the challenge that we're talking about. And there, I think it's about having supports, and they might be mental health supports if things are really rough for that parent, or it could be just parent support in terms of counseling support, or are the parents a couple and are they working together on this, or are they working at odds? And so there's a lot of ways to go at it, and they're going to be guided by what the situation is for the given family.
Dr. Goldstein, because as you're talking, I'm remembering so many of the times when, when I was fatigued and distressed, and we're not always our best selves when we are feeling that way. And in those moments where we kind of lose it and say, I told you just to put your coat on right now, and we are not showing up as our best selves, what encouragement would you offer parents who are maybe feeling like they dropped the ball or they didn't do it right that day, or just maybe feeling that parental guilt of not doing their best job at that moment?
So it's a little bit of a diversion, but like there's, a lot of the youth I treat, and Dr. Rotem talked about suicidality, that's a prominent theme. And there's a hierarchy of importance of things. And although this isn't suicidality, I still think having a hierarchy, meaning the fundamental responsibility of a parent is to keep their child alive. After that, keep them out of hospital. After that, below that, keep them from having severe distress, and recognize that a lot of the things people worry about are way, way down the pyramid.
Mm,
And that when you think about that, the tip of that pyramid, and the steps that are in the top three, it puts a little bit of context in what you're worried about. Um,
that is a great perspective to keep in mind in the, pyramid of priorities. We're getting a lot of questions about specific diagnoses like adjustment disorder. So I'm wondering if you can share a little bit about how people can navigate a diagnosis that they may not understand and how they can advocate for themselves or even for their kids if they are struggling to understand a diagnosis or a care plan. It sounds like there can be situations where information has been given and people are like, I, for many reasons, might not understand what exactly is being presented to them.
Yeah, I can start, Dr. Wilson. So it's not uncommon that families are giving me a call. I would like to just have a meeting to clarify recent diagnosis and what are you insinuating by ABCD, such a thing. So and then we have this. This is the agenda of the meeting: to discuss and provide more education about diagnosis, and we go through the symptoms and what might be here and there. Um, I, it's important to know that first of all, generally, most mental health diagnoses made according to clinical observation. So
Mm-hmm.
we assess, we gather information, lots of information from parents, of course, but if these are kids, but also from the kids, from other allied health and school, and then we diagnose according to the best that we can, according to criteria. Now, I would recommend for those who have some questions or concerns, of course, to go back to these who made the diagnosis request clarification.
Hmm.
It's not again, it's not unusual to do so. Sometimes people ask for another assessment, but usually when you go back to the one who saw you or assess your kid, it solves most of the issues.
Yeah, I agree with that, Don. I think that like if someone has an ongoing care provider, like a psychiatrist or psychologist, and asking for potentially some time at an appointment to talk about questions, sometimes it's a consultation. I see, we see a lot of patients in clinic where they've seen a number of people and they say, well, we never got a diagnosis. And I think some people don't get a diagnosis, but I also think that there's a reality, a phenomenon where you go for an assessment, you're racking your brain about the whole history of the child. You're answering about a million symptoms. You're getting a diagnostic impression, a prognostic impression, and talking about treatment all in the same day. And it's no surprise that
Yeah.
people go home and there's patchy memory, right? So
Yeah.
I think if it's a consultation model, trying to advocate to get a follow-up appointment, even just to check in on questions that emerge from that assessment, saying like, no, I'm not asking you to take me on, in the long term, because I think that would, limit the number of people that would do this, but just to say like one appointment afterwards to ask questions about the impression that was given and that emerge after you've gotten a chance to go home and think a little bit.
Amazing. Next question is, we've talked a lot about parents of anxious children often present an anxiety challenge themselves. So, would you suggest that families work together and encourage each other in breaking their individual cycles of rumination, catastrophic thinking, in addition to stopping unhealthy avoidance behaviors such as procrastination or excessive screen and social media use? Is this a good strategy? Which, kinds of families that, use self-help tools could be helpful, or how would you suggest the family work together?
Yeah, I think for this one, it depends how old the kid is, right? And if they want to do this sort of thing. If I'm understanding the question correctly, I would say that as a general principle, the acquisition of coping skills, strategies in relatives of someone that has an anxiety disorder is a valuable idea. The question of how that's done, like, is that sitting around the dining room table talking about what they did that day to cope? Like, it's hard to see a lot of
Yeah.
teenagers wanting to do that. But I think that the premise that parents can develop these strategies and start modeling them, and then the whole household kind of shifts to some extent, like that definitely resonates with what we see.
Mhm. And it sounds like perhaps, this family is recognizing that, and we can talk about screen time and social media because that's certainly a source and anxiety inducing thing. But it sounds like maybe the parent recognizes that they're spending a lot of time on their screen. They know it's not great for their young person to be spending so much time on their screen. So how can we support each other or make it a family unit challenge or strategy or project to try and support each other in reducing this thing that we know is not good for us? Kind of like, we're not going to keep ice cream in the house anymore if we're trying to cut back on our sugar. Like, how do we work together as a unit?
I think you need buy-in. That's the main thing. So it's going to depend, right? Like that pitch you said, I'm just thinking of 15, 16-year-olds, the idea of like circling around the table and saying, how do we all do this? It's going to be a subset of
Yeah.
teenagers that are down for that.
If only we were the United Nations sitting around the table together as a family all the time. Well, how would, like, screen time is a big thing in families, how if a parent is concerned about the amount of screen time that their young person is spending, how would you suggest they get that buy-in or start that conversation?
Yeah, I would also ask what are you mostly concerned about? So is it the screen time or the things that he's not getting into because of the screen time or what he's doing on the screen, right?
Hmm.
Because if it's the screen time and then the bill that you are getting, oh, okay, that's also I appreciate this concern. But if it is someone who's actually learning or doing stuff that is very positive or creative on the screen, um, I would suggest revising it with the kid together and see what's going on there. But again, if we are talking about technology dependency or addiction, like someone who's, and I'm talking about the extreme here, just because we don't have enough time to speak about it. But if it becomes to be very, very impairing, like not going to school, or very anxious if I'm not having my screen time as I want, or I cannot do anything without my screen unless I get my screen, then we have to find more behavioral solutions to still having the screen, but in a more managed and protected time, right? And this should be true also for all other members of the family, and usually together. So if you have 3 kids, it won't work if you allow to someone to have all the day in front of the video games or the screen, and only one of them, because you're concerned, will only have 3 hours. It just don't work. It should be a whole family change of setting around it, and also make sure safety wise that you're
Hmm.
establishing all the safety measures around. And again, I feel it's a bit beyond the scope of our time, but there's lots to say
Absolutely.
about this, and I think our resources also speak about that.
Donna,
Yeah.
I would
Absolutely.
say that these
Yeah.
questions all come together, right? So there was a question earlier about the fatigue, and I'm just thinking about procrastination. Here's like a kid in grade 10. They're on their
Hmm.
phone all the time. They're always putting stuff in late. They come to their parent for support on it, either to like drive them somewhere or to help out with a project or whatever the case may be. And then at a certain point, the parent is feeling overstretched because they keep on kind of filling in the patches for this effect of procrastination. And that's where, it's easier said than done. So what are you going to
Yeah.
do? Are you going to let the teenager, fall as the chips may with their project and say, you know what, we've had a conversation about screen time. I'm not about to turn off the Wi-Fi if that's the case, but it's going to go how it's going to go, and for future, I'm not going to jump in, or like the next time, I'm not going to jump in. It's not so easy to do that when you're a parent that's anxious. So there's no simple answer to this because you could set a
Yeah.
limit, but that limit itself is tough. But then there's the fatigue if you don't set the limit. So where do you draw the line, right? Are you going to help the kid get that A just by, doing a little bit of a whatever lit search, or helping them with their writing or whatever the case may be, and get them to where they got to go? Or are you going to kind of draw the hard line? And I think that whatever it is, you got to be comfortable with the outcome.
Well, and when grades get involved, that can get really stressful for everyone
Yeah.
about where do you let the, as you say, the chips
Yeah.
fall where they may, and
Yeah.
you say, you know what, you didn't get your project in. I guess, this grade 11 biology project is where you're going to learn the consequence of that. Or, it's hard for parents when it's an academic consequence.
And I think that it's important to know the size of the consequence, right? So getting a B or an A is not a survival issue. It's not a safety issue, and that makes it different. So I think if we're talking about things that relate to driving, to sexual risk behaviors, to substances, that sort of thing, those are fundamental, integrity of that person's safety issues. Whereas a B versus an A is more, slightly impactful. And so making a distinction between what is harm, what is risk, and what is nuisance or relatively worse.
Well, and this next question kind of falls in between those two because I'm seeing lots of parents with concerns about how anxiety is limiting the experiences of their children and youth, particularly around making friends and gaining more self-esteem. So I'm wondering if there's anything, I know it's hard to be so specific when we're in this kind of forum, but when it comes to things like making friends and feeling good in your own skin, how do you negotiate strategies in there for parents?
Maybe I'll start with this one. So, I mean, I think it depends what it means to have trouble with friends. Does it mean there are no friendships? This person have no friends? I think that's a specific category that's a concern.
Hmm.
If it means you're really selective and there's only certain people you feel comfortable with, I think speaking authentically as an adult human who's seen a lot of life and knows that things work out for lots of different types of people, and that it's not one path to success in the future. There's a lot of kids with insecurity and social anxiety, and that fuels in them a resolve that makes them exceptionally successful adults. And some people where it's easy peasy their whole life and everything was smooth, and they never faced challenges, the first time they hit an obstacle in their 20s, they hit a brick wall. So it's not all bad, this anxiety, but to me, I think if they have no friends, that's a concern. Um, but the rest of it is, I think, on a dimension of a lot to few.
Well, and you mentioned something there that I just want to touch on quickly is because we haven't really distinguished between, do we get rid of anxiety or do we just learn to manage and live with anxiety? Because sometimes I think that's an expectation that's important to talk about.
So I always tell my patients, like, what's causing you suffering right now is one day going to make you a really good partner, a really good employee, a really good citizen of society. It just can't run wild, right? I think most people that have anxiety, it's to some extent, it's the earliest onset, except for autism or developmental disorders, but
Mm.
among mood anxiety, just this is something that starts early. For many people, it's part of their temperament. It's not going to be erasable, and nor would you want to erase it, but you don't want to let it, steer your life, right? So I think recognizing the value that comes from the anxiety, and so long as it doesn't really limit or close the door to opportunity, and that's where the exposure I think comes in
Mm.
is um, whether it's like for this friend example that the question came up about. If it's refusal to go to a party because of the concern about not having friends, now you're kind of closing more and more doors, and that's something intervenable.
Dr. Rotem, I'm going to throw this as our last question of the evening, and I'm going to throw it to you because I think this is an important thing that we haven't addressed. Is it seems like any mental health assessment is normally a matter of going private and paying for that assessment. Is that the reality, or am I missing something this person is asking? It's a good
Well,
question. What about
yeah,
financial impact?
yeah, it's a good question. So just to confirm, if you are talking about mental health assessment done by a physician, meaning psychiatrist, these are covered by OHIP. So centers all across Ontario, including CAMH, provide assessments, and these are assessments that physicians see the clients and then they bill. If someone is seeking assessment by psychologists, that's different. But for anxiety or the all of the above disorders that we talk today, you should go to your family doctor and seek a referral to be seen by a physician, a psychiatrist, and then it's publicly sponsored in Ontario.
Well, and knowing that there is a publicly sponsored option is part of the hopefulness of like I think this entire conversation has been this evening, knowing that anxiety is common, but it's manageable, that our brain can change, that open communication, which we can all do at any time, is such a fundamental part of nurturing our family's mental health, regardless of our family constellation. Those are all amazing things. That's where we're ending it this evening. I want to thank everyone who has joined us this evening so much again for taking time out of your busy days to invest in some education and curiosity about mental health for your family. I want to extend a deep, heartfelt thanks to Dr. Rotem and Dr. Goldstein for sharing your expertise and your warmth and your candor tonight. There is a village of people behind the scenes that make events like this possible. So thank you very, very, very much. And a very special thank to the donors of CAMH Foundation, because it is through your support that these sorts of community events are possible. And just a reminder that the toolkit that we've talked about with resources, hopefully these resources will be things that you return to, that you can share, and that will be, evidence that you are not alone, are coming into your inbox in the next couple of days. And finally, we'd love to hear what you think. So there's a very quick survey. It's super fast, 1 minute, that will be popping up onto your screen. If you don't mind taking the time to fill it out, we'd really, really, really appreciate it. Thank you again for being part of this conversation. CAMH is here to ensure that no one is left behind. I'm wishing everyone a really good night.